supporting the government to design policies and laws that are really responding to the needs of the population, or that are health friendly. If you impose laws that are going to create barriers to your population, then access to health services, it's going to be a challenge. So we really need CSOs to be out there speaking on behalf of this community, showing where there are those barriers. If I can give an example. Sorry. Currently we have the human reproductive health law, where young people are not allowed to access sexual reproductive health services without parental consent. That means to access it, you need to have the age of majority, which is 18 for the case of Rwanda. So we need CSOs to come in and advocate for these young people who need services. In addition, we also need CSOs, like she said, in providing services. We need, it's not really the role of the Ministry of Health to provide services. We also need CSOs to provide services, and mostly ensuring that those that are very poor or those that are marginalized, we have to ensure that they are not really left behind. Yeah, thank you.
Thank you so much. He well put that the civil society organizations play a key role in supporting governments with policies, and this is one of the contributions that we should acknowledge and applaud. Moving on forward, the United States Agency for International Development is one of the key partners of the Rwanda government and health sector in particular. Dr. Elizabeth, what approaches has USAID made towards financial protection and improving the healthy outcomes?
Thank you so much. I'm Elizabeth from United States Agency for International Development. I'm happy to be here. I think this is my first time to attend this International Pharmaceutical Students Federation Congress, and I'm happy to share what USAID does here in Rwanda and what we are supporting the government of Rwanda to ensure that we improve health outcomes of our country. Yeah, basically USAID is supporting the government in different sectors. In the sector of health, in the sector of education, democracy and governance, agriculture, and so many areas. We are contributing, actually the investment of USAID focus on in regards to universal health coverage, focus on 4 key areas. One is to ensure the health packages. We have the health packages. We review the packages for the health sector, the health facilities. Of course, we ensure also the private facilities have the document, the guiding document, the package. Secondly, we support the government in improving quality of health care. One, by ensuring that we have the well-trained people, we have the qualified people, they get training, they get skills to manage the patient, to provide services, quality of health care. We ensure we have the accreditation systems. Accreditation meaning that all facilities, public facilities in the country, they go through the mechanisms, the accreditation mechanisms. They are able to assess themselves about their performance, their how they are doing, and try to find solutions to address those challenges. We also support this by ensuring that we do the mentorship programs through different implementing mechanisms. For example, we have some service delivery projects that are being provided that support. One is implemented by Intra Health. This is called Ingobi in Kinyarwanda. But we are supporting the government to ensure that we train people in those areas, such as the MCH, maternal and child health, family planning in different areas. The third focus area of USAID investment in health is pharmaceutical, to ensure that the products are available. The products are available. We provide technical assistance to the Ministry of Health, Rwanda Biomedical Center, and also the medical production, procurement and production of the division through the Ministry of Health, RBC, Rwanda Biomedical Center. We make sure that we provide technical assistance. We quantify our product together. We procure product. And Rwanda has the system where we procure, we sit together, we procure commodities, and we ensure that we have one basket for distribution. Each partner will not come in Rwanda and distribute its own, the product. No, we have a coordinated system where we are able to provide drugs and to ensure the smooth distribution until, to the lowest level of the health system. The fourth area is what he just mentioned about the financial protection. The financial protection, Rwanda, USAID has been supporting the government in terms of ensuring the community-based health insurance is functional, is well managed. It used to be at Ministry of Health, but since its inception, USAID has been working closely with the government to ensure that how is it managed, how our revenue are corrected, how are we producing, how are we assessing performance, or people are accessing services. We are also supporting the government to ensure that the systems, the management, we have different, actually in terms of coordination, Rwanda is doing great. I'm not sure how long it will take you here, this Congress will take you here, but I wanted to say that if you are curious to maybe attend some of the technical working groups, we used to have different forums where we make sure that the support from USAID, from other stakeholders is well coordinated. We have coordination mechanisms at central level, at decentralized level, where at central level we make sure that we have the health sector working group is co-chaired by USAID. So USAID is a big player in this country, and we briefly, this is what I can say. Maybe we have I will have time to discuss more about what we are doing, but this is basically what we are doing to try to be brief. Thanks so much.
Thank you so much, Dr. Elizabeth. You raised something important regarding the capacity building and providing technical support. This is an area where much emphasis is needed, because if the practitioners or healthcare providers are not trained, are not empowered, then the services would not be effective and efficient towards the beneficiaries, the primary consumers. And going on, I would also want to hear from our panelists. Sorry, audience, I will take this time, but I won't forget you as well. It has been seen that different individuals have got theories or evidence-based perspectives that see them contribute less or not at all. and this creates a big gap in collective efforts. I would like to ask our panelists what they think would be the holistic approach towards seeing individuals and communities collectively contributing to strengthening their healthy care systems, starting with Dr. Atanas.
Yeah. Thank you very much for your question. It's really, I would say it's very complicated. You know, different expertise we've got. Everyone is like trying to, defend what he's doing, and we end up creating some, some, if I may say, some gaps. If we don't really take this, taking an holistic approach when addressing the issues regarding the healthcare system, it's going to be very challenging. So we need everyone. So if you are thinking about developing our health systems, we need to be thinking holistically. If, let's say, we have those who are dealing with financing, so you need to make sure that those doing the financing are brought on board. You need to make sure that those who are doing with leadership and governance, they are brought on board, because you are not going to equip a health facility and then leave the leadership. So they are going to make decisions probably that are not effective or appropriate. So you need to make sure that all the 6 building blocks of the health system are really considered. So because of our different expertise, we end up focusing on one small aspect, but in the end, you don't get an improved health outcome. So to be able to improve this health outcome, you need to bring everyone on board so that everyone plays his or her role. If you're a pharmacist, you have a role to play. If you are a CSO, you have a role to play. If you can't provide service, you can probably do work in advocacy. You can support in monitoring and evaluation and inform those who are taking decisions. So we can't really say that there's there's a single block that is sufficient on its own. I understand that by addressing one single block, you end up addressing the other, but differently. So you need to be moving all the 6 building blocks at the same time, and I hope it will be by building that coalition, you'll be able to, deliver effectively and be able to serve the people, especially the most marginalized, because they are the ones who suffer most than the others.
Thank you so much. And this will be an assignment for most of us. Yeah. Are we engaging all the 6 building blocks for the case of Rwanda, for example? It's something we can look into and see if each and every, let's say, civil society organization, private sector, are we all engaging these 6 building blocks. Some other countries also have got their building blocks, but it should be a collective effort from everyone. Dr. Frazier, I see you want to add something.
Oh, no.
Maybe I can.
I think probably for me, having had your question, I would say the health sector needs to improve on the issue of involving the communities. When you look at other sectors, banking, and so whether it's in the public sector or in the private sector. So I believe that for us to crack the healthcare issues and achieve universal health coverage, we need to move more power to the communities and to the households to make those decisions. And therefore, our responsibility being to educate them, empower them to be able to make those decisions, and use the community system to bring them along, rather than having a top-down approach to healthcare. And one of the things I think, and it's quite a success here, is the engaging the community health workers, because those are community-based. They are a community-based resource that the health sector can really leverage to empower the communities, to educate, and to engage so that the health system engagement between the communities and the formal health system becomes less paternalistic and more involving and more understanding and human. So I think if we can crack that, then we'll have people engaging more and people taking responsibility for their health. And therefore, you have less and less requirements for government to make decisions on behalf of communities or even donors or even CSOs. One last thing is, in AMREF, in May, we had to look at how we are structured. And the question was, we say we represent communities, but do we really give them the power to actually decide what they want? And one of the questions we got was, who engaged the community in defining what universal health coverage is? Universal health coverage to a member of the community may be totally different from our understanding. Because for them, probably, health is not access to quality services yet. It's access to information to tell them, when my baby is coughing, what do I do? So I think we need to change the perspective of the health sector to be more focused on the health system, and that all players, even as we talk about the formal health system and the 6 building blocks, to ensure that the community aspect is not forgotten and the ownership of health by the individual is not ignored.
Thank you so much. Dr. Elizabeth, do you want to add something?
Yes, for sure. We just mentioned 6 building blocks. What are those? Because those are 6 building blocks of the health system. One is the health financing. Second, we have the quality improvement, self-delivery. We have also the human resource for health. We have medicine, equipment, commodities. We have the health information system. I think these are 5. And leadership and governance. And I'm happy to say that USAID is involved in those 6 building blocks on different levels. For example, we are using for commodities, we are using our procurement and management system, a project, PSM. I can see one of my colleagues here working with PSM in some countries here or in other countries, implemented by Chemonix. This is a global mechanism that's procuring commodities, and we have information system, we have leadership and governance. I don't want to talk about this. I wanted just to briefly understand what are the 6 building blocks we are talking about here. And I'm coming back to the coordination piece of this question. As I just mentioned, we have a coordination, a very good, strong coordination here in Rwanda, where we have at central level the mechanism of coordinating, involving all stakeholders, and at low level, the centralized level, we have also at the important platforms that we are using as a country, not using as a country, as where the communities are involved, not only the community health workers. For example, let me take an example of one of the best practice that we are using here in Rwanda, the channel, the forum we are using, the umwiherero w'abayobozi. Umwiherero is the national retreat for leadership. This is something that everyone can ask a question. For example, the previous one, was held in March, and the community members were able to ask questions. We have another platform called Umushyikirano. Umushyikirano is a national dialogue where the community themselves are able to engage, ask questions about their matters, their problems. For example, the national retreat in March, one of the resolution, the ninth resolution was improving, finding strategies to strengthen the community health-based health insurance. And this will help the government to find strategies to see how can we sustain this. It has been successful, it has been that, but how can sustain this? Yeah, and those Omushikirano, the community members, they are able to ask questions. They're able to say what they think. And we have at the centralized level, the Joint Action Forum, JAF, at district level. At district level, the community members, they have their representative. They can ask questions. They can monitor. They can do joint monitoring. Understand which partner is intervening here. What kind of interventions is providing to the community. It's important to have that kind of spirit where everyone is engaged, is involved. And we are lucky to have also at national level other platform where we have different stakeholders, civil society, development, but everyone is not working as a single intervener. We are intervening as one team. We have one spirit. We discuss challenges. We coordinate each other. We know who is intervening, where, and what. Briefly, this is what we are doing here in Rwanda, and we are happy to say that young and professionals, young communities can also have a voice. They have a voice. They intervene, and they are really engaged. Thanks so much.
Thank you so much. You want to add something?
Yeah, based on the example she just gave, I wanted to add that, like for us, every health facility you have, it normally has two committees. In French, we call it Comité de Gestion, and there's another one called Comité de Santé. So the one called Comité de Santé and Comité de Gestion, gestion, it's something internal, but Comité de Santé, it's something that affects the whole population in that catchment area. So one of the committee members has to be a representative of the community. In our programming, we use the human rights-based approach, and we have to make sure that both the duty bearer or those who are responsible for either providing service or information, we have to make sure that they are informed about what they owe, like the local population, and also the right to health. So the government really has to make sure that, the population enjoys the right to health by making sure that service and information, they are available, they are accessible, and when it comes to accessibility, that's where we talk about like non-discrimination, financial accessibility, acceptability, so all of those. And we also have to make sure that the quality is there in everything we are doing. Yeah, I just wanted to add that.
That's great, thank you. And from the discussion, I can tell that individuals, communities are engaged either through coordination, decentralization, different platforms, respecting their rights, and others. And it's high time that the audience have also got different message or questions or clarifications, and I would want to hear from the audience. If you have any question to the panelist, someone with the mic will go through, and then we hear from you. Thank you. Question? No, Mike Harrison. Any questions to the panelists?
Thank you. My name is Leon. I am a professional. I work at Mika Pharmacy, which is located in Nyagatare district in this country. I would like to ask Dr. Elizabeth from USAID. She said about their approach to which they use as stakeholders in order to deliver their support to the government, but aiming to the community. I would like to ask her the advantage of approaching community together with government and compare it with the advantage of approaching community directly without involving the government. So I would like to get the comparison of which is the best approach there. Thank you.
Thank you. More questions? We will take a round of like 3 or 4 questions, and then we'll first answer that, and then later we'll go for another round.
Thank you. My name is Thomas Bizimana. I'm assistant lecturer at the University of Rwanda. My question came from what Dr. Frazia told us. Toward universal health coverage, I agree with her that we needed to build a strong partnership between the public, private, and the people. But when you look at prices today, which for me are really a big issue, when you compare prices from the private sector to prices from the public and mission-based sectors, you realize that there is a big gap, there is a big difference. So for you, what do you think is the problem so far? Because talking about universal coverage, you also have to make sure that people can afford pharmaceutical products. Otherwise, you are always going to have problems. So I'd like to hear from you about the problem that countries are facing so far, or kind of solutions to such problem. Thank you.
Another one? Yes.
Rian Afeb, Austria. My question is, do you think your approach in Rwanda is applicable in other countries with different cultures? For example, if we take the USA, it's more a everyone for themselves kind of approach in healthcare. So how would you adapt your system, which works apparently really well, in different cultures? Thank you.
Another question, and then we will let the panelists respond. If there is none, then we can first answer this. The first question was from Leo. Yes. I think Dr. Elizabeth can talk about this.
Yes, this question was about engaging with the government in providing our USAID support, right? And try to compare the engagement and on the other side, not engaging with the government. I think, yeah, it's clear here, when you engage with the government, we have some advantages, as you mentioned. One is to get the right beneficiaries. Let me give you an example. For example, for our OVC, orphans and vulnerable children, we want to pay school fees for the very poor kids. We we use the National Commission for Children, NCC. We use that one to select the poor families, to identify those beneficiaries, and to make sure that the support is well channeled, well delivered to the right person. I think it's important for us to get the right beneficiaries. That's one of the advantages that we had. But when you don't engage with the government, let me give you I don't have that example, because whatever we do, engage with the government. In Rwanda, before you work, you have to present, you have to know where, you have to discuss with the government to identify the areas of interventions. For example, what are the districts that you are going to intervene? Maybe they have PIH, they have partners in health in 3 sectors. For example, let me give you an example. For self-delivery, for MCH, we have partners in health in 3 districts. We have them in Burera. Rwanda has 30 districts. And 3 districts, PIH is there. 7 districts, Belgians are there. Then the rest, the 20, USAID is there. This is how we deal with the government. We sit together, we identify which partner is ready to take over, to take this into this area. Yeah, it's easy. I think I find it a way of coordinating and avoiding having problems with the host government. And the most important thing for USAID is to make sure that the relationship between, of course, the United States of America and the government of Rwanda is smooth. These are diplomatic way of doing business. That's my understanding. And the Rwandan, as a terrain, everyone that know, yeah, most of you know Rwanda, you can't just come and do whatever you want. It's an area where the coordination has helped the country with our strong political commitment. We know we have what we do. We have target. We have one way, one spirit of moving the business. I think it's important to. I see when you don't engage with the government, you can't. It's easy to fail. It's easy to fail. And it's important also because you share lessons. You harmonize tools. You develop tools. If, for example, you see, for example, now they are doing they want each cell of our country to have, okay, when I say a cell, we have the lowest entity, the village. We have the cell, we have the sector, we have the district, we have also the national level. From the village, we have community health workers. For the cell, we want to have at least each cell of our country has a health post. And at sector level, we have health center. At district level, we have district hospitals. At national level, we have, maybe as I'm talking now to pharmacists, we have, at district level, we have also the pharmacy district pharmacists that are working closely with the hospitals, with facilities in their district. But I wanted to say that at cell level, where the government wants to have at least a health post. And the government is ready, for example, to motivate the communities to build using Umugan, different channels. But to learn them, they need private practitioners. For example, now we have what we call Global Development Alliance, GDA, with One Family Health. We gave them money. We want to motivate, to help, to technically assist young professionals to come and operate make sure those health posts operate. Meaning that the government is doing is helping the construction. Then USAID is assisting using that mechanisms. That's mechanism because USAID doesn't directly implement. We use different project mechanisms. Then the one Family Health is helping now the young professionals, the providers, pharmacists, health providers, different people to come and using the private PPP, public-private partnership to make sure they are learning those. Of course, you can't just come and run a health post without talking to the Minister of Health. You see, it's very clear that if you don't engage, you don't succeed. You see, it's important to work closely with the government, and I've seen that we have our country cooperation strategy, and we make sure that we are aligned with the Rwandan context. I think maybe I want to go to the question of my colleague asking me about the different cultures. Of course, USAID does operate in different countries. But each country, of course, has its own way of doing business. For Rwanda, it has been successful. The field is well prepared, if I can tell. Whatever you want to do in Rwanda, you succeed because that's kind of engaging. Actually, I've been visiting so many countries, doing site visits. I've seen that it's important to partner. It's important to understand the context. Whatever you bring, for example, an approach, if you are bringing, an approach, you have to know the context. And, USAID has that capacity of doing so. I'm sure we have that expertise to know the context and to know what is important to this. Because what we want to do is to make sure that the country is self-reliant, is able to do its own business, to develop their country. This briefly what I can say, but I've taken long. Maybe I can leave the mic to other colleagues, but we can also chat. Thanks so much.
Thank you so much, Dr. Elizabeth. That was crucial and important. The time is worth it. You're worth the time. And she mentioned some two key points that I am going with. That's myself. That's once you engage the government, there is no duplication. If you want to operate in a certain district and there is another implementing partner, of course, if you don't engage, you might find yourselves duplicating a small piece of work that could have been easily directed to one partner. And also something important is harmonization. The harmonization process is always key in the implementation of any intervention, most especially in the health sector. Dr. Frazier, there was one question for you regarding the price.
All right, thank you. I think without delving too much into economics, I think we know that you have different types of markets. You can either have a capitalistic market or a socialist market. Now, when it comes to a socialist market, it's very easy to determine pricing, determine how the players within that market operate. But in a market where it's capitalistic, it means that you allow the market forces to determine how people price their services, how they compete. So it's a free market to allow everyone a chance to do their best and attract the most. And so that then brings the issues where you have a private sector overpricing. But then when you look at that market, it's because there are not enough players to compete. And so, for example, in Kenya, when I worked in the insurance sector, one of our biggest issues was the cost of care because you have only 3 major hospitals. And so everybody has to run to those hospitals. So they actually have more more demand than the available supply, meaning they price higher and higher to create their niche customer. And so with that, it meant that your prices then are prohibitive for most members of the community. And so I believe when you look at, going back to the economic theory, the role of government is to ensure that there is enough infrastructure so that I can make that choice. So investments in having facilities, investments in having, enough pharmacies, for example, within the country to allow me as a consumer or as a payer to strategically purchase, to have that power to say, I'm not going to shop. Why? Because when I go there, they don't smile at me. That's an option. Or they are too expensive for me to afford that service, even if I have an insurance cover. So I think it's an issue of ensuring that we respect the market that is operating, but also have the roles of the different players well determined and well delivered. Because if the government can ensure, for example, it works with the private sector to have enough facilities and enough medical providers, it means then that you and I can have a choice. But also it's important to communicate to consumers and users. So one of the issues was, if you don't tell the communities what is accessible to them, they will see what they can only see within their space and go there without necessarily knowing 5 kilometers away from them is a facility that can offer services at a higher quality or even at a lower cost. So I think it's how we coordinate, going back to Dr.'s comment, how do you coordinate services and ensure the communities are aware of where to go and their rights in terms of determining what is appropriate for them. And then looking at responsible business for private sector. I think right now it's still the quadruple bottom line that people are looking for, where it's about profit, people, planet, and the other one I've forgotten. So, and it's aligned to the SDGs. So how do you encourage private sector to have responsible business? And one of the ways that has happened is for the pharmaceutical companies, right now with the access to medicine index, their share value is determined by how they score in that access to medicine index. And what does that access to medicine index measure? It measures what programs have they put in place to ensure people can access their innovative molecules. Secondly, what pricing innovations have they put in place to ensure that people can actually afford? Some have established cross-subsidization so that those who can pay the highest premium, they can pay that. And those who cannot afford, then having an appropriate price. And so that now makes the pharmaceutical companies aim at having more access to medicine programs, because then their share value increases, and so it meets their objective of increasing shareholder value. And so there are different models that encourage the private sector to be more responsible about how they go about their business. I think, and lastly, is to say that we must realize that the health sector does not exist in isolation. It exists in a system that has so many other sectors. And so we cannot then push for, how do I put it? I mean, we have to try and ensure that the health sector changes itself or transforms itself to operate within that market. And that's what I was saying. It's a high time that I, as a doctor, must be so aware of the needs of my patient that that's how I structure my services, as compared to saying they need us, they'll come, we'll give them the medicine. So that approach, I think, has to change. We have to be more customer-centric as a healthcare sector, so that gives that person the power to choose and influence those market forces, so that at some point I have to price appropriately for me to get customers. So I think that's what I would say.
That's great. Thank you. And a question I would also ask myself and the audience: do we use these models? Do we even try to find out if the models are there? Are they working? And do we get a chance to utilize the models that are in place? And if we have our markets, do we try to see that we adapt to what is available? And it's something we can think about with time. We would also want to hear more questions, or you want to add something?
I just wanted to add a few comments. They have mentioned almost everything. But for me, for the question from our colleague Thomas, I think, for me, I see it as an opportunity, especially for NGOs who are here to, be the voice for the voiceless. Like for us currently in Rwanda, we are doing an advocacy work to try to, make sure that the prices of medicines are really regulated. If you say that it's 1.5% you are going to add, let's respect that. If I take an example of like one of the popular drugs we are currently like advocating for, so they can reduce the price. When you check like Norevo, so emergency contraception, you go from one pharmacy to another, the price is like 4 times higher, like the initial price where they got it from like a wholesaler, like pharmacy. So you can imagine how like the end user is going to be. If it doesn't have like 20,000 you are charging, then the results will be that she's going to get pregnant. And next time, what will happen, it's going again to be an unsafe abortion that will result from that. And this unsafe abortion becomes back to the health facility and the health system. You are the one to, again, pay that price. So if the government does not really control this, I know it's very hard to control it, but we need to join efforts and advocate for these changes. And for our colleagues who asked about how we can replicate the Rwandan model, I would say it's very challenging. There are different reasons why like the Rwandan model has been successful here. If you can say for us, like we have only one language. Almost when you go in any part of the country, we are speaking one language. So the communication makes it easier. And when you see how small our country is, the accessibility is very easy. It's different from like Congo. Probably when you want to go in a different province other than Kinshasa, it's going to take you hours and hours. So again, that also it's another aspect that has made that success possible. And the structures, we've talked about structures. So from the national level up to the community level, we have structures that are well established with strong monitoring system. And there's that high, strong political commitment. So this is not, again, something you can like force someone to, take over. So it really requires that different governments who want to adopt this model, they have to be committed to improve like the health outcomes of the population. And the other thing is that for us, we have formal laws. We don't have like tribal laws. When you go to other countries, it's totally different. There are national laws, but there are also formal laws that are there. I mean, tribal laws. And sometimes tribal laws, you might see that they might take precedence to formal laws, so which makes it difficult for these countries to implement it. The other thing about structures, when you go to some countries, like for us, if the government elaborates a strategic plan, this strategic plan, it's going to be implemented from the national level up to the community level. But for other countries, if you have different counties, probably they are going to choose what they have the means to implement, which again makes it difficult. So for us, everything that is agreed at the national level, it's also implemented at the community level. So it's very difficult, but probably for the case of Rwanda, we need to document these evidences, show that they are working, and be able to create different platforms where we can share these lessons. And those who want to take over these lessons, I think they can learn a lot from it. Yeah. Thank you.
Thank you so much. We are running out of time. I would like to welcome just one burning question to the panelists as we wind up. If there is any one burning question. I think Yes, one. Mike.
Rian Afeb, Austria. Sorry, that's GA stuff. Sorry. I have another question because we were talking before lunch, just for a short moment, about how much money your government spends on health, and it's a lot. It's 18% as far as I can remember. 16?
17.
That's still a lot. Sorry. That's amazing, and I absolutely applaud you for it. But do you think that maybe that is also one of the main reasons why this works so well in your country? Because you use so much, you obviously care so much about the health of your people. That's why you use so much money, and that's why it works so well. Thank you.
In 15 seconds, each panelist, and we wind up.
So I would say that Rwanda has, like, if I can say, made an investment case for, investing in building the health systems. So by investing in, like, building strong health systems, you earn a lot. There are economic benefits. Like, if I can say, like in 2014, Rwanda was spending around $1.7 million for just managing complications from unsafe abortion that have, like, happened in different corners of the country. So you can imagine how much money the health system was losing. But by making sure that everyone now has access to, sexually productive health services, if you need information, you can get it. If you need service, I understand there are still challenges, but making sure that at least the local population have access to this information and service, it's really important. Again, for the SDGs. So you cannot achieve SDGs. SDGs are like human rights. They are interconnected. So by investing in one, you end up also affecting the other. And then investing in, like, building strong health systems improves also, like, health outcomes. And you cannot really become a community that is self-reliant when you don't have access to, health service or, good health. If you don't have good health, you cannot really do anything. Yeah.
Thank you.
I think for me, what I would say in conclusion is that every country must design its own UHC roadmap. I don't believe that there's a one-size-fits-all. And so each country must take into consideration its context and develop a roadmap that includes the communities and other stakeholders. And I think the other thing was that I just wanted to just say one thing. Sometimes it doesn't mean that more investment equals more health. And so there's a lot of work coming from building a system that can absorb that money to then deliver on the mandate of the health sector and ensure that the money goes to the right purposes. And so as we advocate for more money, let's make sure that we're building the right systems to absorb that money and use it in the right way. Yeah.
Dr. Elizabeth, as you wind up as well.
Thanks so much. According to the most recent health financing strategic plan we developed with the government is allocating 17% of the national budget, to health. Meaning that Rwanda is achieving the Abidjan Declaration, which is very important. But the most important is how the money is used and how it's spent. And the government has developed the different channels of ensuring the public finance, the PFM, the public financial management is well done. In the USAID, we are currently supporting that field, addressing all those inefficiencies. There are different platforms of accountability. For example, the performance contract. How did you spend your money? where did you spend this? You know, a transparency, you know, a transparent system that is very, you know, observed here in Rwanda is very important also. Because there is a strong political will, and also when you look at those, you have also to look at the levels of corruption in the countries. That's important, because if you want to be accountable, you have to look at those, you know. And I don't mention the numbers here of levels of corruption, but I'm sure the low levels of corruption in Rwanda is one of the key drivers that is helping the country to move and to spend the money, the money to the right need. Yeah, briefly, this is what I can say. Thanks so much.
I would like to say that we are coming to an end of our discussion. We started late, but we tried to keep time, and the package was big, but at least we had at least like 50%, but with time it would have been even much bigger than this. And I believe that the discussion will go on individual based and doing more research and engaging these people, of course, not only here but even after here. And I would say thank you everyone, thank you panelists. The discussion was really educative, engaging and constructive. Let's say thank you also to the audience for your contributions and additions. We are going to have another session, so I would say thank you and have a great evening.